It's just after 9:30. Welcome back to Breakfast Television. Prime Minister Justin Trudeau opened his daily address to Canadians with word that long-term care homes in Quebec will get support from Canada's military.
I can now confirm that some 125 members of the Canadian Armed Forces who are trained in healthcare will go to Quebec and help the workers in their long-term care facilities. We continue working with the government of Quebec to find other ways of supporting them, including with the Red Cross and specialized volunteers that are registered with Health Canada.
Trudeau announced more help for workers in the energy sector in an effort to clean up inactive wells.
Companies have had to slow down or pause their operations, leaving too many people out of work. To help these workers, our government will invest $1.7 billion to clean up orphan and inactive wells in Alberta, Saskatchewan, and BC. These wells, which are no longer in use, can be detrimental not only to our environment, but to people's health.
And finally, Justin Trudeau says millions of Canadians have applied for the Canada Emergency Response Benefit and millions of payments have been made.
We continue to support those who've lost their jobs with the Canada Emergency Response Benefit. So far, over 7.5 million payments have been made. That's money sent directly to those who need it most. I want to, again, thank our amazing public servants who are processing these claims at record speeds.
The Canada-U.S. border will not reopen for another 30 days. Canada and the U.S. have reached an agreement to extend the border restrictions by another month. The deal is awaiting final approval. Today, the province is expected to release the latest modeling projections around COVID-19. The latest projections suggest social distancing measures have been working to slow the spread in this province. Meantime, BC reported its lowest increase in COVID-19 cases in weeks. 14 new cases were reported yesterday. The total number is now 1,575 in our province. 3 more people have died, and 2 more outbreaks were reported at the Kootenay Street Village long-term care facility and at the Ridge Meadows Hospital. In total, 26 long-term care and assisted living facilities have outbreaks. An inmate from the Mission Institute has died from apparent complications related to COVID. It's the country's first COVID death in a federal prison. The inmate died Wednesday at Abbotsford Regional Hospital. Earlier this week, a mobile hospital was sent to Mission to treat infected inmates. So far, 54 inmates and 8 correctional officers at the prison have tested positive for the virus.
It just, I think, is a message to everybody about what can happen. This time last week, we had heard about very few cases there, just a few, and then a little earlier last week, no cases at all. And now I think it's in the neighborhood of 60, 61 cases. So it shows what can happen, and that's why we have to be vigilant everywhere. Even in health authorities, for example, that have relatively few cases, it shows what can happen in a facility such as that when this virus spreads.
Leaders in Metro Vancouver's tourism and hospitality industry have set up a recovery task force to respond to the devastating effects on the sector. They say many of the government relief initiatives launched in recent weeks have not been accessible to most members. The task force is urging the province and the feds to bring in policies that prevent commercial tenants from being evicted and establish rent assistance for small businesses. An employee who works at the Superstore on Grandview Highway in East Vancouver had tested positive for COVID-19. The employee has not been in the store since last Thursday. The company says store employees who worked closely with the infected colleague are now at home in self-isolation. The store was closed for a thorough cleaning and reopened today. A fire burning in the Squamish Valley has grown to more than 100 hectares in size. BC Wildfire Service says at this point it's 0% contained. Helicopters spent the day using buckets pouring water on the flames. More than 36 firefighters are involved in the battle. Evacuations remain in place, with some people told to leave their homes and their animals.
We just went up and we moved 10 horses to higher ground up the Squamish Valley. So they're in greener pasture. The fire doesn't seem to be moving up that way at this time. So we're very happy to have them safe and on some greener pasture away from the fires, because where we were, there was a lot of open fire and a lot of open flame. We're actually lucky they were let loose, and the rancher this morning rounded them all up and put them in the pen, and they all kind of stayed together, so it was pretty awesome and easy to do.
Andrea Ross says there's fire damage at the Squamish Valley campground. She says it's a tight-knit community and everyone is trying to help each other out. New research out of Washington state shows the harm of visiting just one friend during the COVID-19 pandemic. Miranda Fatur explains.
Even I didn't understand it until I saw it.
We've been told to stay home for the past several weeks, so you may be feeling restless, isolated, and lonely. Maybe you've even considered visiting just one friend. Well, a new study from the University of Washington is reminding everyone how quickly COVID-19 can spread if we break social distancing rules.
You can imagine an entire room of people, 100 people. Everybody stands up in a big circle, holds hands. Nobody has more than 2 partners. The entire population is connected. So that phenomenon of low-level linking being an efficient method for spreading infection is not what many people understand, and it becomes particularly important in a setting like now where social distancing is the only thing we have, really, to prevent the spread of infection.
This represents life before COVID-19 without social distancing. The green dots represent 200 different households, and the gray lines represent social interactions between those households who are not following social distancing guidelines. And over here is perfect isolation. As you can see, households do not interact with different households, meaning that the virus really has nowhere it can go.
We're very good at discounting risk from people we know and love and trust.
And perfect isolation is not possible because some people have essential jobs. According to the study, this is what interactions look like if 1 in every 10 households have an essential worker.
It's like water going to ice, right? So you get all the way from, 50 degrees down to 33 degrees, down to 32 degrees, and you don't see any change. And then bam, you get ice. That's exactly the same process that's happening here.
Now, the question we've all asked, what if I visit just one friend? Well, if 2 people in each household decide to meet with one person from another household, the network becomes reconnected very quickly.
As soon as you see that, it just hits you. Oh, that is so much more connected than just the essential workers out there. It's not at all what my brain thought it was going to look like. It's really connected.
Even if a household agrees to let only one member visit a friend, that still leads to more interactions than in the example of just essential workers.
Previous generations had to make much bigger sacrifices than we're making right now, so you can do it.
So it's important to think twice before getting up close and personal with a friend. In Richmond, Miranda Fatur, City News.
I like that. I like what that one man said. Previous generations have made much bigger sacrifices, so we can do it. All we're really being told is to just stay home, right, and watch movies.
Yeah, exactly. Everything is relative, and we probably got it pretty easy as far as our self-isolating requirements are concerned, Mary. And this weather pattern